Hi, everyone. It's Nicole Maliatakis. Thank you for joining us this evening for one of a series of town halls that I've been having to talk to you basically about the issues that are affecting us. Obviously, we're all very separated and we can only be in contact mostly through social media. And so I put together a great panel today. I'm very proud to have the following three physicians with us because they are not only from our community and understand what we are going through, but they have really been in the front line through this whole agonizing crisis that we've been experiencing. So I want to introduce our doctors next to me. I'm assuming the squares are all in the same order as I'm looking at them. And next to me, we got Dr. Sal Volpe, who joined us before. Dr. Volpe has 25 years experience in primary care. He is certified in pediatrics, internal medicine, geriatrics, healthcare quality and management, and former president of the Richmond County Medical Society. And with us today, we've added two new friends. And on the bottom, right beneath me, is Dr. Anne-Marie Stillwell, who's a board certified interventional pain management specialist who has practiced interventional pain management and anesthesiology for 24 years. Dr. Stillwell also just returned from volunteering to care for COVID positive patients at the Javits Center. Thank you, Dr. Stillwell, for your service. And we're going to want you to speak about that in just a moment. And also joining us this evening is Dr. John Mays, who is an internist and a geriatrician at Island Internists. He also serves as a chairperson of the Disaster Preparedness Committee of the Richmond County Medical Society. He has 30 years experience practicing medicine, and I welcome you all today. Thank you for joining me, and thank you for taking some time to answer the questions that those in the community have related to COVID-19 and where we go from here, because a lot has happened since Dr. Volpe and I first had our initial conversation. And at that time, it was more about, how do I protect myself? How do I handle mail and packages? How do I handle groceries? It was more about transmission. It was more about getting the test. And so today I want to shift and talk a little bit more about what we know now compared to then, how telehealth has been working, because I know particularly Dr. Stillwell has been using telehealth with her patients. And what the future of telehealth may be. And I know also John Mays is an expert in telehealth as well. Talk about a little bit about transmission, the transmission indoors versus outdoors. And as you know, I've been making a push for the golf courses, the beaches, our public parks to be able to open for us to enjoy this summer, as long as we're practicing social distance. So I'd like to hear your thoughts on that. And then potential treatments and vaccines. And where we are in that process. So first, Dr. Stillwell, I'd really like for you to share with everyone your experience being a doctor that was on the front line caring for COVID positive patients at the Javits Center. And again, thank you for doing that. And please share with the group about your experience.
Well, being an interventional pain physician and anesthesiologist, I actually consult for the Department of Health. So when they were going to be opening the Javits Center, they asked if I would be willing to go there and be a medical coordinator. And what it involved when we first got there was trying to communicate with the Army and the Navy and the Department of Health and National Health Service, because we've had a whole fleet of people coming together. Nobody knew each other. Nobody knew what we were capable of doing. But all we knew was our mission, which was to decompress the hospitals from all of the semi-stable patients that were experiencing coronavirus at that time. And we saw the numbers building as we started the very first week. We were non-COVID at the Javits and in the Comfort boat. And as we saw that week happening and we were contacting the hospitals to say, what can we do for you? Their answer was, we don't have any time to talk to you. We just are too busy taking care of patients. So what we ended up doing was sending teams of doctors and nurses out to the hospitals to get patients. And that's when we turned COVID and started taking those patients. And essentially over the course of April 6th for the following week, it was just a matter of getting FEMA, who supplied the ambulances, and we had about 250 ambulances around the city at our fingertips to go to each individual hospital where there were 5 things that needed to be done for each patient in order for us to be able to evacuate them out of there and get them over to the Javits. And they needed essentially a face sheet, a nursing sheet, 5 days of medication, a bracelet on their wrist that we could track the patient and know where they were, wherever they were in the city. And we also needed, what was the other thing? Oh, just their list of discharge summary, so we knew what was going on with the patient. And literally, it was like the scenes at the hospital were like cartoons where people run in with the stretcher and they basically take the patient and everything is on the stretcher and they just ran out because there was absolutely no time in the hospitals they were too busy taking care of the very sick, that the people that needed oxygen but were healthier and on their way down their own little curve of experiencing the disease were brought out. And I'm happy to say that in the 4 weeks that we had the facilities open, we treated approximately 1,200 patients, which thank goodness wasn't the 2,900 all at once that we thought we were going to be having. And we had approximately 6 deaths at the Javis, which I think out of 1,200 patients says a lot for the care. The nurses, the doctors came in from all across the country. So they didn't even know each other. They just knew that they were all part of the Army and they had this mission to do. And I
think it's amazing. And I also think that, I think it's absolutely amazing. And yes, we had so many volunteers come from all over the country and the governor should not be taxing them. It's not a way to say thank you. So I'm on board with those who are saying we should not tax those people who came from all over the country selflessly to help us. I want to jump right into one of the first questions. Dr. Volpe, you studied pediatrics. You are certified in pediatrics, Kawasaki disease. Some parents here want to know what's prevalent about it and should they be concerned?
Initially, the feeling was that the people coming down with this multi-system inflammatory syndrome was a variation of Kawasaki's disease. As more children appear with these findings, there's about 85 in New York State, about 55 to 60 in New York City. The feeling is that it's not Kawasaki's disease. Kawasaki affects between 10 and 20 kids under the age of 5. It's a very important number, under the age of 5. So 10 to 20 kids per 100,000 under the age of 5. This particular inflammatory syndrome affects children up to the age of 18. So they're not the same. Kawasaki, one of the signs you'd see also is you see a redness around the eyes as well as changes in their skin. So with this particular syndrome, a child of abdominal pain, fever that doesn't seem to respond to medications, they may also a rash, and they may also have some changes in how they respond to you, changes in medication, confused. So the short answer is it does not appear to be Kawasaki's disease.
Okay, Dr. Mays, you and I had an interesting conversation. For those of you who are just tuning in now, I had a meeting with the Richmond County Medical Society the other day, and we had a very good conversation. I really wanted to just pick their brains and talk about where we are and where we're going as a community. How do we provide the best care? How do we get our essential elective surgeries back on track? But one of the things that I thought was very interesting was you were talking about how transmission is less likely outdoors versus indoors. And I'm wondering if you could touch a little bit on that, because I've been making a push for construction industry to get back to work, try to open our economy. And I think outdoor work would make sense. We have been doing affordable housing construction throughout the city, even in the worst times during this crisis. And there haven't been incidents reported as a result. We started seeing the mayor start sewer work again, roughly 30 people at a job site. As long as there's protective measures in place, and of course, construction industry, they have OSHA training, they wear PPE, social distancing. Is it safe for industries that work outdoors to try to go back to work so we can try to jumpstart our economy a bit?
So thank you for that question, Nicole. just to level set a little bit, so I represent here the Medical Society Primary Care and what is the command center of Staten Island, the Borough President's Office. So everyone should be very proud of their legislative leaders and the Borough President for having an incident command structure to deal with this particular disaster. So we're constantly getting feedback in, and we're constantly making recommendations and changes to the medical landscape. So people on Staten Island should be reassured by that. In answer to your question, when we look at the data, it shows that transmission is much greater indoors than outdoors. It has to do with how ventilation works in a room and how air conditioning moves the virus across a room. So if you're in a small room and you have a high density of the virus, it's going to flow from one person to the next. Same as you get transmission in an airplane. When you're outside, the wind basically blows it away, so you don't get that high concentration. So it's safer outside than it is indoors when you want to do outdoor activities. So it's good for people to get out, not only for their mental health, but their risk of transmission outside is much less. They still have to social distance, but with social distancing, a mask outside, a relatively safe and relatively decreased transmission rate.
Okay. You've also been very much involved in telehealth. Can you talk a little bit about how telehealth is working? I'll give you all an opportunity to talk about this because I know you all have your different experiences. But I guess, telehealth is a great thing, right? It gives people an opportunity, particularly in this type of circumstance, to be able to consult with a doctor without having to leave their home. What do you think is the future for telehealth now that we've been forced to use it? And how does it affect senior citizens who may not be, have you found that there's been difficulty for senior citizens to be able to use telehealth and to train them to be able to use it?
Initially, go ahead.
Oh, go ahead.
Initially, I've been using telehealth even before this pandemic, essentially for elderly patients because it was difficult for their sons and daughters to bring them in for office visits frequently. So when it happened that we couldn't see patients anymore in the office or shouldn't see patients, I just switched everyone over. So on the very first day, it was difficult. It was taking assistants a long time to get people onto the telehealth because they maybe didn't know how to use their cell phone for anything other than a phone. And maybe they had to borrow their children's or have their children help them. And initially patients were, I can't do this. I don't want to do this. Just call me. Why do I have to do this? Can't I just come into the office? I had some patients just come into the office and say, I don't care. And they're knocking on the door trying to get in. I'm not going to do that. And we took them through it. And it took a lot of patience on the part of my staff, and I'm sure on the part of everyone's staff. But now that some time has gone by, they're actually enjoying it. You can actually, I think, spend more face-to-face time with the patient. And I think that they like that more because you're not busy staring at you're staring at a computer, but you're staring at their face instead of staring at the computer, typing. So for me, at least, I've enjoyed it. I think the patients have enjoyed it. I think psychologically during this time, we as physicians may be one of the only people that they're seeing all week because they're not getting out, or they're just seeing the son or daughter, and they want to share their anxieties, what they've heard on the news, etc. So for me, it's been good. I hope it stays this way. There are some things that they need to come into the office for, and they're going to have to get back to coming in the office, especially if they want treatments or if we want to do a physical examination or draw blood. Okay.
And Dr. Mays, would you like to add to that?
Sure. So we on Staten Island, we accomplished a remarkable feat. About 15% of our doctors were using telehealth before COVID-19. And within 30 days, we were able to get 85% of our practitioners using telemedicine. So necessity is the mother of invention, that's for sure. And where patients previously were reluctant to engage in telemedicine, they're now embracing it because of the fear of going to a doctor's office. So it's been pretty remarkable in that sense. But I think the important reason why the adoption of telehealth took place was not only the need for coronavirus 19, but we had alignment of technology, policy, and reimbursement. So the government relaxed the rules on HIPAA compliant devices, so people could interact with their doctor on FaceTime, which is the technology they're comfortable with. Reimbursement policies were in effect that you're allowed to do the visits in such a way and get compensated at an appropriate rate for office time. And then the third, the technology's been here all the time. You know, we've had FaceTime and we've had other things, but they needed to be HIPAA compliant. And a lot of the HIPAA compliant technologies were not as easy for patients to use as something like FaceTime. So we're hopeful that with some modification of the rules going forward, that telehealth will be here to stay.
Okay, great. I want to go right into something that has been important to me and that I have been talking about 3 weeks. I started right when we were coming over the apex here. I urged the governor to start thinking about how we can move toward resuming elective surgeries here in the state of New York. Since that time, there were 35 counties roughly that were instituted, and I think today he announced a few more. Of course, New York City and our neighbors here in Long Island are not included in that. However, the good news is that local hospitals have begun scheduling the urgent elective surgeries. So, Dr. Volpe, can you maybe talk about what are some of the things that would be considered urgent elective surgery? So to give people the peace of mind that they are beginning to schedule these things. There is quite a backlog based on what I was reading earlier today in our local hospitals and across the city. But, you know, I have a lot of constituents that were waiting for procedures like mastectomy, like a procedure for kidney blockage, hip replacement, glaucoma surgery, and they were in pain, they were suffering. So we want to give people hope here. Can you talk a little bit about where we are with elective surgeries? And go ahead.
Sure. Thank you, Assemblywoman. That's a good question. Actually, I reached out to some of our peers at Staten Island, and Dr. Stillwell actually had some very good opinions on this, but also opinions from gynecologists. So there are logical procedures related to ovaries and to the uterus that, as you said, could be elective, but with time become urgent. So if you have issues with a myoma, which is a growth on top of the uterus, and it needs to be evaluated because it could lead to excessive bleeding and other issues, that's the type that these doctors feel very comfortable working on. They also, something we don't think about is maybe a surgical procedure, but requires anesthesia, are things like colonoscopy, things that have been falling behind in addition to vaccinations for kids and adults, is colonoscopies, procedures related to ear, nose, and throat. Any procedure, quite frankly, that has a very, very low probability requiring hospitalization. So there are many specialties, and they're putting together lists of their requests. You know what? If I have a problem with a meniscus in my knee and I just need a little flap taken, and I'm not going to undergo complete knee surgery, why not let that proceed? So when it comes to orthopedics, there are many arthroscopic procedures that require very minor anesthesia. Gynecology, colonoscopy is a classic example, as well as EGDs for people who have chronic heartburn who are of getting cancer of the esophagus and of the stomach. Again, a minor procedure requires very little anesthesia. So those are the types of procedures that I would say that statistically have not led to urgent, and many of these can be performed in the doctor's offices now. Again, to Dr. Mason's point about reimbursement and just the way things have been done, many procedures are performed very safely now in doctor's offices, and they follow the same guidelines as one in a hospital in terms of maintaining safety and anesthesiologist and so on. So I would encourage people who have been putting off preventative medicine procedures, putting off getting a workup for something that's been bothering them, to please call their doctor doctors, see what's available in their offices. And as was mentioned by Dr. Stillwell, many doctors now have non-COVID sections, COVID entrances. So we should feel more comfortable going to the hospital to have procedures. We should feel comfortable having them in the doctor's offices. And something that has occurred is there's been a large drop in a number of people going to the hospital and strokes. And that does not mean that COVID-19 protected people getting a heart attack and stroke. Well, and not. It meant people were just very, very afraid to go to the hospital. So another message that I would put out there is, if you need to go to the hospital, do so. They're there to help you. And because we've been very lucky with the drop in hospitalizations and new COVID patients, they have the capacity now to take care of you.
Thank you, Dr. Volpe. I want to go right into the issues of treatment and vaccinations. Anthony Franco, as you see, a question has just popped up. He'd like to see hydroxychloroquine to be approved to be used. And I think, I want you guys to talk a little bit about, where is it in the process? Because I did see that the FDA did approve certain treatments already. And I want people to understand that the governor had done an executive order that prevented hydroxychloroquine from being administered for COVID, although it is used as malaria, lupus, and other illnesses. And there's a reason for that. Maybe one of the doctors could explain. But there is a trial that was being conducted. We also were able to get the governor to lift that ban so it could be used for compassionate care, particularly senior citizens that were in nursing homes. And so maybe, let's see, Dr. Mays, would you like to talk about this and where we're at in this process and what other treatments and potential vaccinations are in the works?
So, that's a really good question. It looks like the data is showing that hydrochloroquine is not effective to treat COVID-19. Initially, we thought that maybe it would be, but as studies are being completed and data is being rolled out, it doesn't look like it's as effective as we first thought. Now, none of the studies that are out there are double-blind control studies, which in medicine is considered a gold standard. They're sort of anecdotal studies of small populations of patients. So we really don't know. But when you talk to people, and we've been talking to people around the city and the state and in other states and even other countries, no one is seeing a treatment that is definitively helpful for this particular disease. There is one antiviral agent that's shown that the symptoms decreased from 11 days to 8 days. But again, it really hasn't, no treatment has been demonstrated to be truly effective yet. We have a website up for all the healthcare professionals. It's www.covid19statinisland.com. And we post all the trials and all the research papers that are relevant for the doctors and healthcare professionals on Staten Island. So we try to keep people informed, and you can look on that website. It's not password protected, but you'll see for yourself that there really is no effective treatment right now. As far as the vaccine goes, very aggressive timelines to try to develop a vaccine. Some are in testing right now, which is pretty amazing. But we need to make sure that those vaccines are safe. Vaccines can cause side effects like Guillain-Barré, and we need to make sure they're effective, that the vaccine is not worse than the disease itself. So we probably will not see a vaccine until probably the first quarter of 2021 at best. So it becomes really important for people to make sure they get their flu shot this fall and their other immunizations. It's important for children to get their immunizations so that we can eliminate those diseases when you present with symptoms, because some of the COVID-19 symptoms overlap with some of the other diseases that are in the community.
Speaking of let's see, we had someone asking, Kara was asking us about whether vitamin D and there's other vitamins or supplements that can help boost immunity. or I guess just, I guess we got a couple questions here about different vitamins. Is there anything that you can take that may help you, prevent you from getting sick? Is it like the flu or a cold, where if you take vitamins, vitamin C, for example, that you can perhaps prevent yourself from catching it?
There are a few studies that are going on using high dose vitamin C intravenously that were initially done in China and tried again in Italy. And I think there are some doctors here in the intensive care units that are giving their intubated patients high dose vitamin C intravenously, and they're seeing some results, but they really need to do a full blown study. They're also seeing some results with melatonin, which is sold over the counter in CVS. They're seeing some results with zinc when given in combination with the hydroxychloroquine and the Z-Pak. So, but we really don't, these are anecdotal. These are by physicians the same way anecdotally in a lot of the hospitals. I noticed in New York, as time went by from the beginning of the pandemic to the end of April, we were seeing patients at the Javits Center that were coming, some were on Eliquis and some were on Lovenox, which some were on sub-Q heparin, and from different hospitals, they were coming to us on different blood thinners because the intensivists were seeing that some people were having clotting from the coronavirus. So I think we are needing to see what are the right things to be doing and what are not the right things to be doing, and studies really need to be done. And I know it's difficult to tell people we really need to see what studies show, but we don't want to hurt people in the process of making a determination just because it helped for a couple of people that it's going to help for everyone. So we can't make that decision. But there are, these other medications that some people are using, high dose triamcinolone, which is a type of cortisone, intravenously when people are first hitting the hospital, and that seems to be helping some people. So we really need to do the studies.
Well, another thing is, they're monitoring and measuring all sorts of different blood levels in people while they're in the hospital. What has come up is vitamin D. We found that people had very, very low levels of vitamin D, with severely low levels of vitamin D, were more likely to have complications from COVID. Now, we're just getting through the winter, spring, kind of. We did have some snow, I think, over the weekend. But as we do the social distancing at home, our vitamin D levels are going to drop. What you may want to do when you talk to your doctor and they're ordering tests for you, you may want to ask to get your vitamin D level measured to see where you stand. There's nothing else in terms of supplements that really makes a difference with this type of disease, at outpatient side. But if your doctor feels that it's reasonable for you to take vitamin D, that's what to do. And just as Dr. Mace mentioned, a very popular website for the physicians and healthcare providers, there's a website for the organization that I happen to work with, which is Staten Island PPS. So StatenIslandPPS.org. We have multiple pages to give information to lay people, information regarding where to get masks, how to get tests, what to do when you're depressed, who can you call when you have anxiety attacks. So for anyone listening or watching, pass it along, because it really is a nice digest of resources from the city, state, federal, and beyond of resources out there for us, how to exercise while you're at home.
Dr. Volpe, give that website one more time, because you are breaking up a little. We're going to have to get you better internet service, just like I need better internet service. If anything, we're learning who needs better internet service during this crisis. What was the website?
Staten Island. Everyone knows Staten Island. Then P as in Peter, P as in Peter, S as in Sal. So Staten Island PPS.org. O-R-G.
All right, fantastic. We heard it that time. Lorraine would like to know, speaking of whether a few of you, there's only 3 of you, you've all said that it is important for people to do get their routine visits. And Lorraine wanted to know if it was safe to go to the Quest lab to have routine blood work taken. at this time, or should she wait a little bit?
I would go. If
Yeah,
I did routine blood work at Quest Lab, I would go. I would wear my mask. I would do social distancing. Quest Lab is following the CDC. They're wearing their PPE, and I would get my usual blood test done. I don't think there's any reason why you shouldn't.
Okay. Dr. Annie Fitzpatrick. We should have Annie come join us next time. Dr. Annie Fitzpatrick wants to know if antioxidants and anticoagulants, which is a word I'm not familiar with, help in an active case. Sounds like something Dr. Stillwell would answer.
There's anecdotal evidence that shows antioxidants help. As far as the anticoagulants, they saw on CAT scans when they first started doing CAT scans when patients were having pneumonia way back in March, when they had the time to get CAT scans in patients, that a lot of patients were having blood clots in their lungs from having the COVID pneumonia, which they called pulmonary embolism. And they would start patients on blood thinners. So after seeing that, they routinely started patients on blood thinners because the assumption was that they were having clots in the body. They also saw some younger patients present with strokes and heart attacks and absolutely no pulmonary complaints, no shortness of breath. And they tested positive for the coronavirus. And so the assumption was that for some reason, with no previous medical history, these people are clotting. Maybe we should be putting them on anticoagulants. And that's, once again, we need to really do studies to see if this is what caused it and if this is the right thing to do in order to help people. But I think that there's a downside to using the anticoagulants. We feel that it helps people from our observations. I mean, we've only been in this for 2 months.
Right.
We've been in this for 2 months. And when we entered this, I'll never forget the first day I entered the Javits. I walked in with a face mask on and an N95 mask on, and no one else had a face mask on in the room. And within a week, everyone was wearing a face mask. And now we've been wearing face masks for 2 months. We're social distancing. So we are coming down off the curve at a totally different place than where we started out. And I think because that, we are now doing social distancing. We know how important it is. At the beginning of the curve, we were going to the St. Patrick's Day parade on Staten Island on Forest Avenue, and we were on top of each other. And now coming down off the curve, we know we shouldn't be that close and we should be wearing masks and washing our hands. And now everyone is taking it seriously. So I think we're going to come off of this at a so much better place where we entered it. And I think that that's why we need to get back towards living a more normal life, you know, as quickly as we can.
Lana had a question about summer camps. Will it be safe to send kids to camps, considering new compilation that kids are suffering from COVID as well?
I guess I'll take that one.
Good.
Because I'm a dad. And
A resident pediatrician.
And anyone with kids can chime in on this one. You know, the thing is, while individuals under the age of 21 catch COVID, carry COVID, but do not seem to be as frequently hospitalized, it does not mean that it's safe for them to be interacting without masks and without distancing. Having sent my kids to some summer camps on Staten Island, I think it would be very hard to keep the children from maintaining a distance. I'm not saying possible. Think of sports like swimming, golf. There could be long distance running. So there are activities that kids could do, but activities in which they're going to be exchanging an item like a ball, means that one child could be carrying COVID could be giving it to another child who has not. So I think there will be activities outside, creative, because we want the kids outside. As Dr. May said, it's important from a psychological point of view for us to go outside. It's important for us to get our vitamin D to go outside. It's important for us to get our exercise. And the best way to do it is either walk up and down your steps inside your house 50 times a day or take a lap around your block. But again, if you go outside, I really cannot overemphasize this. Wear the mask. I always have a mask with me. Even when I'm by myself, I have my mask with me. And the reason for that is, what if someone walks up to me? What if I need to walk up to someone else? What if I'm not going to engage in a conversation? At least if I have the mask, put it on and interact with people. We don't want it to become this weird post-apocalyptic sort of environment where, oh my God, there's someone within 5 feet of me, I need to jump away. If you have a mask, you jump away 1 foot, and then you can still engage with them. The mask, again, just to remind everyone, because I'm looking at the comments also, the mask protects the other person more than it protects you. The mask you wear in the hospital protects the healthcare provider and protects the patient. The N95s, they're very hard to breathe through all day long. God bless the people who work in the hospitals all day long. But normal walking about, a simple cloth mask with or without a filter inside it is adequate. All you want to do is prevent the droplets that are coming out of my mouth and are covering my computer screen right now, which is probably why you can't hear me clearly, getting to the other person. And those droplets, that little bit of spittle, can move 6 feet, 12 feet, and some people say up to 20, especially if you're Italian. You can see me waving my hands around. We're very demonstrative. So spit can move a good distance. So if you wear a mask, you're protecting the other person. You're showing how much you love your neighbors.
Okay, so that was Teresa's question, whether the mask really protects us. Is it okay to walk in the park without a mask? Dr. Volpe is saying no.
Well, I'm saying you can by yourself.
If you're by yourself, if you're not going to be running into a crowd or another person, you don't have to, right? Is that the answer? Really? I mean, that's
have it on you. And if it's no one's in the park, I don't say for this to walk in the park by yourself, but I'm talking walking in the neighborhood. If you're by yourself, I've seen people not wear the mask, but they got it with them because they need to put it on.
Yeah, and Vincent asked earlier on, what about gloves? Vincent wants to know, there's no glove mandate, so he wants to know if you should still wear gloves, or what is the benefit of wearing gloves?
I'll let everyone else jump in, but the glove mandate is just a limited thing because inevitably we're going to touch our faces with the gloves. We're going to touch areas of our body that can carry the COVID. So you wear the gloves, but it's only a short-term barrier. We wear them in the medical office so we don't contaminate the patient with what we have. But in terms of day-to-day activities, the most important thing is wash your hands, wash your hands, wash your hands, wash your thumbs. People forget to wash their thumbs. And then I've been encouraging everybody, especially Dr. Mason and I, who have more facial hair than other people, wash your face.
Yeah, you need a helmet.
Right.
You need to wear a helmet, not a mask.
Bubble, right? But what's happening is we're intermittently touching our face. So when you wash your hands and you forget to wash your face, you may have, here I go, break the rules. I've got like maybe some COVID potential. I'm not joking around. I'm being serious now. I could have potentially put some of it on my face.
Yeah.
So if I touch my hands, wash my face, and then I do this and touch my eyes, I just expose myself.
And Dr. Volpe, I think that this time of year in particular, it's very important to emphasize that. I have very bad allergies, and sometimes my face is itchy, or my nose. So it's difficult to not touch your face during allergy season if you are someone that suffers from allergies. I can tell you that from my experience. So that is important to use hand sanitizer, to wash your hands, to just practice good hygiene, particularly, when you're coming in and out of the house, but also when you're handling mail, when you're handling pets, when you're handling groceries. Yes. These are all the things I learned from Dr. Volpe in our last segment. Let's see. We had some. Dr. Mays, would you like to comment on the antibody tests? Anthony Franco wants to know, are there any specific antibody tests that we can easily access and trust? There's no list of approved tests on the FDA website. He is an essential worker. Thank you, Anthony. And he would like to know more about what he should be doing in terms of the antibody test.
So that's a great question. And I think it's safe to say is we don't know. There are multiple antibody tests that are being used, some of which have been validated, some of which have not. It's hard to know which test measures the test correctly, that if you have exposure. So to talk a little, let's take a step back and just talk about antibodies. First of all, we don't know what antibody protects you. Okay. What we do know is that you do get an antibody reaction, and these tests test some antibody, but it may not be the antibody that provides you with immunity, and we're not testing the level, what's called a titer, right? Which is a level of antibody that you have. So you can be positive for the antibody, but it doesn't make you immune. Okay. So there's a lot we still have to do. We're not even sure if the tests are testing correctly in terms of if you test negative, right? A test sometimes can come back negative, false negatives, and sometimes they're what's called false positives. And they're exactly what they say they are. That means you have if it's a false negative, you have the disease, but we're missing it. And if it's false positive, it registered positive, but you might not have it. And so all the tests out there have not been fully vetted like we normally would for a test. So the antibody testing is not really pieces of information you can make a decision for yourself. We can look at it on a population basis, and it'll tell us how many people were exposed to the virus. But it's not a piece of information where you can say, oh, I have the antibody, I'm not going to give the disease to anybody else. I mean, I got a lot of these questions last week for Mother's Day, grandparents who wanted to get antibody tested so that they could see their grandchildren on Mother's Day. And the answer was no, it doesn't provide you with immunity. It doesn't provide us an answer yet. Now, in a couple of months, we will have an answer to that, but currently we don't. And we have to be very careful about that, because people think they have the antibody test and they're safe. So they're not wearing the mask, they're not washing their hands, they're not doing the social distancing.
Yeah.
That's a bad practice.
Oh, I'm sorry, doctor. I didn't mean to interrupt. If you had something else to add to that, or else I wanted to give Dr. Stillwell an opportunity, because I know that she's doing the antibody test in her office. And so maybe Dr. Stillwell, you can talk about, I know there's the blood test that you can send to the lab, and that's what many of the primary care physicians are doing. Then there's a prick test, and then can you kind of just go through what the options are and what you're doing in your office?
Well, there's the blood test, and that's the test that you can get through the city right now, where they actually draw your blood out of your arm and send it off, and it takes like 2 or 3 days to get the results back. And that will tell you if you have corona antibodies. They're not quite sure yet if that's the exact coronavirus COVID-19 antibody, because the test could be testing just for a coronavirus that you were exposed to at any point in your life. Exactly. But assuming that it comes back with both the IgM and the IgG, and not to give a whole dissertation on it, IgM is what you initially form to a virus, and IgG is your long-term immunity to the virus. So if you come back with both of those positive, you could just assume that it most likely has come from the most recent COVID virus that we've been exposed to. Now, I've had patients, I'm seeing patients in my office when they're in such severe pain, because that's what I do, pain management, that they need some type of treatment. So it made me feel better to at least test them to see if they were exposed. I would say, gee, go get a test done for the actual virus. And if they weren't exposed, well, still, I'm not really sure what to tell you, whether you may have it, may not have it. As Dr. Volpe said, we don't really know exactly what the answer is telling us. But since the tests are available, and they were not very expensive, I said, this particular one came from a great source. I've been using this company for a while for other products that I use, and all those other products are doing justice for myself and my patients. I said, okay, I was going to purchase them. They're made in the United States. They weren't coming from overseas. And I did my own little testing. One of my medical assistants, fiance, had COVID, was tested, had the antibodies, was going to be going and having them donated because he's 27 years old. I said, come in the office. You're not a patient, but I just want to see how reliable my test is. And when I did my test, it came back positive for him having the antibodies also with me. But then the other day, I did another patient who said, I had the antibodies test done. I want my shot. I'm okay. I'm good. And came in the office. And when I tested him with the antibodies, it came back negative. I had a gentleman who never had COVID symptoms, but had a gallbladder attack 3 weeks ago. He went to the emergency room for. They tested him negative for the COVID. Now he comes 3 weeks later and he's positive for the IgM and the IgG. Was that abdominal pain he had 3 weeks ago really COVID? But because the COVID virus test is only 70% positive, did he actually have it? And we just didn't test them. I mean, the 30% of the patients who came into the Javits Center, looked like they had COVID pneumonia, acted like they had COVID pneumonia, were being treated, required the oxygen just like COVID pneumonia, but 2, 3, 4 COVID tests came back negative for the virus. So I don't think the tests are accurate as we'd like them to be. And because of that, as physicians, we can't give advice because we don't know what the right answer is, I hate to say.
I mean, it's interesting that the governor and the mayor are putting so much effort into getting people tested. If the tests aren't reliable, I mean, how do you really make a judgment based on that to move forward? I mean, that's I think a big challenge and something that no one's really talking about, and that's why I'm talking about it. But I think on this point, though, Dr. May said something interesting the other day, and I think Dr. Volpe had also when we were talking with the medical society about second wave.
Yeah.
And I think one of you predicted August there could be a second wave.
That's what I said.
So it was you. So please tell the group, because I think people need to know what's happening and if there's a second wave. And as Dr. May said, a vaccination probably will not be around until 2021, but perhaps there'll be some form of treatment, a reliable treatment this summer. Can you talk a little bit about that, Dr. Volpe, what we can expect in a second wave?
So this year has been a relatively mild flu season, but last year and the year before that were very, very severe. Emergency rooms were packed with flu victims. ICUs, especially pediatric ICUs, had many, many people suffering from influenza. So as horrible as this COVID pandemic is, it's 10 times worse if you superimposed influenza on it. The problem, and the reason why I brought it up at the meeting is just because we had one mild year doesn't mean next year, this August, is going to be mild. So influenza is a seasonal illness. And what happens is it begins in the northern hemisphere above the equator around, and it starts moving faster and faster. And then you get around November. And then it continues. It used to die off around February, March, but now we're getting till June. So the reason why there's a problem is if this influenza this season is as it was 2 years ago, as Dr. Stillwell said, and I believe Dr. May said, in terms of getting vaccinations, because the initial symptoms are going to look the same. People are going to worry, do I have COVID? Do I have influenza? Both are serious, but COVID seems to be more lethal. The other thing that's going on is as we open up park, as we go outside more, it is inevitable that there's going to be an uptick. Every other country in the world has had an uptick. Korea started at the same time as we did, late February. First real number of cases being found. They've been around for about 6 weeks or 2 months earlier, but towards the end of February, that's when our numbers popped up. That's when South Korea's numbers popped up. Between testing, isolation, test, then you do tracing because you want to know who was exposed to the illness. And then what is that person? The first person, you isolate them. The second person, you want them to be isolated because they could be, we don't use the word isolate, I'm sorry. But you want to quarantine those people. So what's going to happen is, as we go outside, more and more people enjoy the summer, there's going to be the second wave coming.
Yeah.
That's what we have to look out for. And quite frankly, the Spanish flu had 3 waves. March 1918 and the summer of 1919, there were 3 waves, and the second wave was worse than the first one. They wore masks, but there were a lot of people who rebelled against wearing masks. And we can learn from their mistakes. We can avoid the millions of people who passed away Spanish flu by doing what's being recommended by the CDC. Wear those masks, keep your distance. I had said previously about wearing a mask. Quite frankly, I would wear the mask all the time if I were outside, if I could bear it, because it's one less thing to remember when I interact with somebody.
Well, Dr. Volpe, I appreciate that. And we have Terry Marie is asking a question. Terry Marie is one of my constituents who made me a homemade mask. And she's been making homemade masks for so many people in the community. And we want to thank Terry Marie because, as was mentioned, while doctors and nurses and those who are in the medical facilities may not be able to use a homemade mask, they need the N95s or surgical masks. Yeah. The homemade mask can provide protection, particularly for people that want to go enjoy the outdoors or want to do some food shopping. So thank you, Terry Marie, for my mask. I appreciate it. And thanks for all you're doing to help other people. Terry wanted to ask a question, and it kind of piggybacks of what Dr. Volpe was saying. I'll give the other 2 doctors an opportunity to answer. If we reopen, and if we reopen in several areas like beaches, plus parks, plus golf, which I have been advocating for us to do, we will not be able to detect when an uptick comes. We need to open in a very controlled manner. So I'd like to hear from our medical professions on exactly how we go. Because look, there's obviously so many different opinions in this, right? Our governor is utilizing the CDC guidelines, which I think is smart. However, I do believe that there are certain areas where we can open now, as I mentioned earlier, construction, outdoor home improvement, parks, golf, tennis, the beaches. I believe that we can be opening up outdoors quicker rather than waiting until September to start phase 1 in downstate. And then you have the school of thought where we should just open up everything immediately. And, there really, really depends on who you speak with. Everyone has a different opinion. I'd like to know the medical professionals' opinions on this. I assume it's similar to what Dr. Fauci said yesterday, which is there's a balance here. And I think that is wise. There's got to be some common sense to that, but also some science behind it. So maybe the doctors can kind of tell us what they believe is the right approach as we look to move forward and try to reopen, try to get back to some sense of normalcy here in the city of New York. What are your views on that? We'll start with Dr. Mays and then Dr. Stillwell.
So, it's a great question because there's tension between getting back to normal, the economics of not being open, and also the mental illness that occurs from being isolated and anxious all the time against the transmission of the virus, and we know what the virus can do. So we have to try to find a balance between those 2, right? We can't stay isolated forever, right? But when we do open up, we need to follow the precautions that are there. I mean, social distancing, 6 feet, wearing the mask, washing your hands frequently. When you come home from being outside, take a shower, put those clothes in a separate place, wash those clothes separately. If you follow those principles of good hygiene, then the risk of transmission is going to be lower, and we can find a balance between opening things up and protecting ourselves from COVID. And that's really what's so important. What's happening in the other places once they open up, especially among the young people who feel they're invincible, they're not socially distancing, and so they bring the disease back home to their parents or grandparents, and that's how you get this uptick. And Dr. Volpe's point about camp earlier, if it was my child, I wouldn't send them to camp because you can't guarantee their safety.
Right.
And second, when you're picking play dates, the child has to be able to understand. So if it's a 13-year-old or a 14-year-old that understands what social distancing is, then, they can probably have a play date, with a mask and appropriate distancing. But I don't know of any 5-year-olds that do social distancing at all, and they share a lot of things amongst themselves, and the mouth is another a point of research with items that they find. So you don't want to have necessarily unsupervised play dates with small children. So a lot of this is about common sense and finding that balance. So we do need to go out. You can't stay in. We can't stay in forever. And to the people who asked about what can I do to upregulate their immune system, probably the single best thing you could do is walk. Physical fitness uplifts your immune system tremendously. Not to mention good mental health, and that's also important. If you're feeling anxious and having issues, where you're feeling very anxious or depressed about being indoors, then you got to seek the appropriate help. So those are the things that you sort of have to balance together with the decision making of opening up.
My mom, who is a senior citizen, she's 76 years old. She started to walk now more. I mean, she was staying indoors, but now she's just started to begin to go to the park and do a little walk a couple of miles, and she feels good, and it's good for mental health because she was getting very anxious staying indoors, and she wanted to go to the store. She wants to go shopping. She just wants to get out. And so this was a good thing for her to be able to do by herself, and it was safe. So we recommend definitely people go for a nice walk, particularly this weekend's going to be lovely. And if it is, then you should definitely go for a walk. But I want to also drop the New York State Emotional Support Helpline because look, people are getting depressed. They are getting anxious. They may have lost their job. They may have concerns about if their small business is going to be able to remain open. They could have lost a loved one. There's so much going on in people's lives right now. And we want to make sure that people know that there is an emotional support line, which you can call anytime to speak with someone, 844-863-9314, 844-863-9314. Dr. Stillwell, if you want to add to what Dr. Mays has said, and then a last question I want to lump in there because we only have a few minutes left is vaccinations. Can you please talk about the importance of vaccinations? And hopefully there will be a vaccination for this strain of COVID. But yeah, Dr. Stillwell, would you like to help us wrap up here?
I don't know if any of us know what exactly the right answer is, but I do know that the reason why we shut down this country, the number one reason why, because we initially didn't know exactly what this virus was doing, because we only saw Wuhan and then we saw what was happening in northern Italy, was because we were worried that our healthcare system was going to get overwhelmed. And it just about did. If we didn't have the centers in the different boroughs and the Javits in order to be able to decompress the hospitals from all the admissions, and a lot of people were sent away from the hospital that people don't even talk about, that they were told, you're not sick enough, go home. And some of the people actually turned sick enough and never went back. So we can't overwhelm our hospitals. That's the problem. We, number one, don't have enough hospitals because they've been closed, and that's because of the insurance companies, but we won't go there. And number two, we just don't have the capability of dealing with all of the sick. And it's only right that if you're sick enough that you feel you need to go to a hospital, that hospital takes care of you. Abby, that hospital takes care of you. So we can't overwhelm the hospitals. That's the number one thing that we can't do. So in order to not overwhelm them, we need to open up for the sake of everyone, but everybody needs to behave. And that's what I tell my patients. I tell everyone that I say, if everybody behaves when we open up, wear your masks, wash your hands constantly, and don't do things like they just did in Korea, where they opened up all the bars and one man single-handedly went to 8 bars in one night and infected hundreds of people. I mean, that's just not acting considerate to your fellow, countrymen. So if we try to do that way and get back into things, we won't overwhelm our hospitals. That's what we mean by surges. We don't mean surges of people getting sick. People are going to get sick. We don't have a vaccine. We don't have medication. We know what the high risks are. If you are high risk, meaning you're elderly, or you have one of those comorbid medical problems, you know that you're high risk. You have to be particularly sensitive to where you're going to go and what you're going to do. But for the people that aren't, they need to get out there and behave so that we can get back to a more normal life, so we don't stress our hospitals. That's it. If I get sick, I want to be able to go to the hospital and be treated. I don't want to be able to be told, we just don't have enough staff, we don't have enough beds, we can't handle you. Okay, that's personally what I want people to get out of the knowledge of what we as physicians need to happen.
Thank you, Dr. Stillwell. Dr. Mays, Dr. Volpe, we answered Kara's question about the importance of vaccinations, even for measles, and will that affect children and the spreading of these deadly viruses and diseases?
So yes,